Want to master the medical billing cycle? Let's break down RCM in simple steps.
Verify L1, scheduling and pre-registration. Capture patient demographics and insurance before the visit. Eligibility and benefits early to avoid claim surprises. Step at check-in, get signatures, copay collection, and confirm demographics.
Accurate documentation drives correct charge capture tool. No missed services. Professional coders translate clinical notes into CPT and ICD-10 codes for claims.
Submit claims electronically with clean data and correct payer info.
Payers adjudicate the claim, tour, some paid, some denied. Remittance explains why. Post payments and bill patients for remaining balances promptly.
Track denials, appeal mistakes fast and feed. Timely appeals recover revenue. Finally, follow up AR, optimize workflows, and measure KPIs Pulchi. Keep cash flowing.
That's the RCM cycle in a nutshell. Follow for deeper guidance.